Welcome back. With us right now is Mark Glavinick. He is the Hoag Director of Rehabilitation. And right now, that new center is open down the road in Irvine. It opened a couple months ago. Mark, welcome.
So nice to meet you, Ken.
It's a pleasure having you here today. And tell us about the new outpatient rehab facility that opened just a couple months ago. I was telling Mark right before we went on, I know that you have one down in Newport. So I was surprised this one just opened 2 months ago. I thought it opened a while ago, but I know so many other things have opened in that area as well. So it's great to have that one here.
Very good. Yeah, the community has embraced that new rehabilitation center. And so we've got the newer village that's across the street from Hoag, Irvine. But we are actually adjoining the main hospital there, which is great. So it puts us really in close proximity to the main hospital.
Yeah, that's fantastic. Now, when people think rehab, when they hear that word, I think what comes to mind is they did something to their knee or their back. They had some kind of surgery done to their shoulder. That's what they think about with rehab, which I know is, of course, true. But what about different services that are offered? What does this outpatient rehab facility offer and encompass?
Yeah, great. A lot of folks may have heard of physical therapy, like you said.
Yeah.
Sprain an ankle, twist, a knee. But a couple services that are different that folks don't realize that we can help with. One of them is balance. Balance is a big issue that we can address from a physical therapy perspective and really work to improve. We want to decrease that fall risk and really improve one's independence. Vestibular rehab is another unique one that physical therapists will treat. And then the two other disciplines that not many folks know about until they need them are speech and language pathology and then occupational therapy. So occupational therapy and speech therapy, two big areas that we're providing in Irvine
Speech
as well.
therapy, that surprises me.
Yeah.
I wouldn't even think about that when I hear the word rehab.
Well, and the thing is, you think about it and you probably think, okay, speech, I get that. So if someone has a stroke, they can't speak, that's pretty important. But then the second part of that is their ability to swallow. So swallowing can be another big issue for folks. And so we actually have in our outpatient center the ability to do clinical evaluations in the clinic, and then we'll go over across the street to radiology and we'll do those modified swallows with the radio dye so that we can really see what's happening inside of that throat.
That's very interesting. And because of all the different services that Hoag has in that location, you have that ability to do that, just go across the street, right?
Yeah.
So obviously this type of rehab care is so important to the patient who's recovering. And I would think that not only does it speed along the process, but you're around experts, and as you said, you can do X-rays and things to really figure out what's going on. Obviously, if it's surgery on their shoulder or something, that's a whole different thing. But I didn't even think about all the other stuff you said.
Yeah, exactly right. Again, even with occupational therapy, things that we take for granted, everything that it took us to get here this morning, Ken, everything from coordinating our alarm clock to getting out of bed, getting dressed, taking a shower, using the bathroom, managing breakfast, and my self-care, all those things that we take for granted until we can't do them.
You mentioned balance, and that plays such an important role because as we know, especially with seniors, falls are devastating, far different than when you're 30 or 40 or even 60 compared to being older. And so that balance part of it really plays out. And tell us maybe some of the things that how maybe a certain disease or medical procedure can affect balance.
Yeah, balance is a huge thing that we forget about until we are unable to function. So falls are going to occur at a rate of about 1 for every 4 Americans. And so those falls can oftentimes result in a severe head injury, it can result in a broken hip, and we want to prevent that if at all possible. And so clearly then what we do is we work to train balance. We put folks into situations that challenge them a little bit further to really build their confidence and challenge those balance centers, because we can get improvement in those centers with ongoing practice. Again, it's kind of the idea if you don't use it, you lose it. Well, I get fearful and then I don't go to the theater like I used to. I don't go walk at the park or the beach because the terrain's uneven and it's hard for me. But then what happens is that my body adapts. and then my balance decreases.
Yeah.
When really we want to push into it and train in that area so that we can improve and keep that independence.
And that's a good point that you just made. And some people may not notice that they're adapting, but it's not necessarily in the long term the right way to go.
Yeah.
Yeah, I can totally see that. So as far as something like that is balance goes, there can be a lot of causes for that. I mean, there being simple inner ear infection, right?
Yeah, for sure. Our inner ear issue, so vestibular system is a great place to start to look, as well as our vision. Our vision plays into our balance in a huge way.
Right.
And then also the nerves coming up from our legs and our body telling us what position we're in. Those three systems really interface perfectly in balance. But you're right, it can be affected if you've had a stroke, if you have Parkinson's disease, even if you just have a peripheral neuropathy, a diabetic neuropathy.
Right.
Your vision, your balance can be greatly affected.
Yeah.
And so really what we do then is we strengthen those other systems that can improve still. And so by strengthening those systems, then we're going to build that confidence and we're going to improve balance.
And for the patient, that can take several weeks, or it just totally depends?
Most folks go through a course of therapy that lasts a few weeks to a few months.
Okay.
It just depends. Typically, we work with folks one-on-one. Our sessions, again, are just under an hour, and we usually meet a couple times a week.
Okay.
That home program is pretty important too,
Yeah.
because if you're working on something and you're only doing it twice a week, you're not going to make as many gains as if you're working on it most days of the week.
Right. That's like anything, no matter what you do, right?
Sure.
A lot of rehab practices around Orange County and do different things. How is Hoag different? What does it offer? I mean, right away, as we started this conversation, I was saying that to me, rehab is physical therapy. You wrenched your knee or something like that happened, but all the different things that play into rehab is just amazing to me. Is that what really Hoag has to offer? Plus the plethora of services that are surrounding.
Yeah, I think really Hoag gives us the environment that folks come to expect with Hoag, which is going to be state-of-the-art, beautiful, neat. And then I think the second piece of it is really the individual relationship they develop with the therapist. So in opening this new practice in Irvine, a couple of our clinicians actually went there from Newport Beach. And we figured that would be great to help make sure the culture stays what we know. What was interesting to me was that there was a good number of patients that lived in Newport Beach but were willing to drive to Irvine just to stay with their therapist. And so that was very interesting to me. And I think it highlights the uniqueness of our clinic is really about the people, it's the staff. Yeah,
I can understand that. You get used to somebody, you like how they're reacting to you and helping you out. And if they happen to move to a different location, you're going to do everything you can to stay with them.
Exactly right.
Now, what about scheduling an appointment and referrals? How does all that work? From what you're telling me so far, these are patients who have already been to their primary care. There's an obvious problem. Maybe they've had surgery. Maybe they've been in the hospital. Is that how they go through to get into the outpatient rehab center?
Yeah, exactly right. So if they've had something big happen, a knee replacement, a stroke, then typically the doctor will write a prescription for some physical therapy, occupational therapy, speech therapy. For those cases where it's maybe not as obvious, maybe your significant other says, honey, I noticed you're kind of tripping a little bit more, or your balance doesn't seem as strong. I'd say that's a great opportunity to have a conversation with your primary care doctor. Okay. Say, doc, I'm kind of noticing my balance isn't as good as it used to be. What do you think? And see how that discussion goes. If it seems appropriate, bring up, say, I've heard physical therapy can help. What do you think? Yeah. And so with that physician referral, you can give us a call and we'll set up that first appointment. Okay, so that's the thing. The first is speaking to your own physician. Correct. Or obviously you're going to get a referral from the hospital that you were in and go from there. Right. And sounds like you folks do just about everything there. Yeah, anything to do with rehab, right? We try. Yeah, that's fantastic. So you're located right down the road, and a wonderful area and all the different facilities that Hoag has there. I'm going to give you the number, and this is the Irvine number, 949-557-0630.
And I think if anything, even if they have a question, they can call you folks first.
Please do.
And then from there, they can help them out and say, well, you know what, have you talked to your primary, and go from there. And then the website is hoag.org/patient/rehab. So hoag.org/outpatient-rehab. Mark, thank you for coming on.
My pleasure, Ken. So nice to meet you.
Yeah, that's fantastic. All the things that you offer there, and things that I never would associate with a rehab facility. So fantastic. Thank you for coming on. I hope to see you again soon.
My pleasure.
All right, we'll be right back.